Welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us for another segment. In this segment, we're going to be having a conversation with Dr. Vivian Hernandez-Trujillo. She's joining us here from Allergy and Immunology Care Center of South Florida to talk about guidelines by the National Institute of Allergy and Infectious Diseases that recommend parents and caregivers introduce peanut-containing foods to infants as young as 4 to 6 months. Welcome to Health Professional Radio. Dr. Trujillo, thank you for joining us.
It's very much a pleasure. Thank you so much for the opportunity.
I mentioned, of course, that you're joining us here from the Allergy and Immunology Care Center of South Florida. Give us a bit of your professional background. And I also understand that you have life-threatening allergies, as do some members of your family.
Yes. So I am a pediatric allergist and immunologist. I've been practicing for almost 20 years, and I founded the Allergy and Immunology Care Center of South Florida, really due to my dedication really to patients with food allergy. We do have unfortunately, many people in my family, including myself and 2 of my daughters, and one of my nephews that has very severe peanut allergy. So it's a topic that's near and dear to my heart, not only professionally, but also as a patient and then as a mom. I think, having food allergy, some people may think, oh, it's not a big deal. Food allergy really does affect your quality of life, and it can affect your quality of life. So having correct information and being informed for me is very important, and I'm happy to participate in any way, sharing my experience with my patients and being with you today.
Well, tell us how prevalent pediatric food allergies are and some of the major foods that contribute to that number. We're going to talk about peanut allergies specifically, but surely there are many, many others.
Yeah, so about 8% of children with food allergy in the United States, that's about 1 in 13. So if you think about your typical classroom, two students per classroom are affected by food allergy. Specifically to peanuts, 2.2% of U.S. children under the age of 18 are estimated to have a severe allergy to peanuts. But as you've said, there's other foods, and the most common foods include eggs, milk, peanut, tree nuts, soy, wheat, fish, shellfish, and sesame. And those are the most common. As I tell patients, they'll ask me, can I have an allergy to avocado? Yes, the answer is any food can become a food allergen if you have that predisposition. But the reality is that these are the most common.
Can you, eliminate a food allergy if you're introduced to that food early in life, or is that the whole problem, that you're born with an allergy and, you've got to deal with this from now on?
And that's an excellent question. So, early in infancy, one of the most common allergies may be milk allergy, for example. So some of those patients start very early in life. But now, there's guidelines really over the last 5 years that have been created because we've noticed that there's been increasing numbers of patients with peanut allergy and different food allergies. And what we want to do is try to mitigate this and try to prevent it if there's any way possible. And that's one of the reasons behind the guidelines, is trying to, decrease the risk of children who are at risk having food allergy, and introduction of the earlier peanut may actually decrease the prevalence by 80% for some of the at-risk infants. So that's really what we're aiming to do when we are talking about earlier introduction.
Is it too late once a child is, say, a toddler or a preteen to try and mitigate some of the allergic reactions? Do kids react differently at certain ages to the same allergens?
So yes, because infants and toddlers are not able to communicate with us, it's more difficult. So adults and anyone who's responsible for that child really needs to be paying more attention, because they can't tell us if they're having itching or throat tightness or if they feel chest tightness. And in younger children, we know that Allergic reactions can be, they can present either as a rash or hives, which I will say one thing, having cared for many different patients over the years, hives may appear, as red raised bumps, but depending on your skin tone, it might be harder to see and it might be less obvious. So it's important to keep that in mind. Infants and toddlers are more likely to present with persistent spit up or vomiting or sudden tiredness. In general, some of the common signs of allergic reactions are, difficulty breathing, repetitive cough or wheezing, having some new rash or hives. Occasionally, it can include swelling of the face, of the lips, again, the persistent vomiting, and then, it's very scary if they suddenly become limp or lethargic, but that certainly can happen as well in more severe cases.
We've all heard of anaphylaxis. Explain to our listeners what anaphylaxis is. What are some of the signs that a person is experiencing anaphylaxis? And does it also present differently in children, young children, older children, and even adults?
Yes, so anaphylaxis is basically it's a serious allergic reaction. It's rapid in onset, and it may cause death. Mm-hmm. It typically occurs minutes to hours after exposure to a specific allergen, and generally involves 2 or more body systems. So the systems, the presentations that I just talked about that go along with food allergy, those all relate to the anaphylaxis. So they do, they can present differently. I think as a pediatric allergist, one of the most difficult things, and this is true honestly with any patient, patients that can't verbalize, they can't tell you what they're feeling, it can be more difficult to know what's happening. However, I will also say, and this is where, we as parents, your children better than anyone. So if you're introducing a food or you're seeing something that's just not normal in your child and something that's just very irregular, then that should be a red flag for you. And that would be a reason to seek medical attention, immediate medical attention.
Someone with a known allergy to certain foods, they need to be prepared, not only, when they're going out to eat or, when they're out with friends at a friend's house, they need to be very aware of, what they're eating. But we're talking about kids. How do we prepare? How can we plan for such an attack or an accident or someone not paying attention when it comes to protecting our children?
So the general rule for my patients and for my own children is if they're going to be out with anyone, wherever they are, they need to be prepared for an allergic reaction because we don't plan for those things, right? Like you can't know when it's going to happen. So an epinephrine auto-injector has to be available at all times for immediate access. And I'll tell you, and I've learned this very early on, you can teach even a young child who's verbal. So if it's an 18-month-old who's speaking or a 3-year-old who's speaking, and they're allergic, let's say to nuts, you teach them to say 2 words, no nuts, so that when someone's going to hand them a food, they can say no nuts. That's all they need to be able to say. And it really does work to protect them because if they're not with the family at every moment and they may be at a party and an adult hands them a cookie that has peanuts, and if they're used to the role play of, okay, someone hands you a new food and you say no nuts or no milk or no eggs, it really can be an important mitigation. And I've seen it over the years. It really works.
Great. Well, if you would give our listeners a website where we can get some more information.
Absolutely. So I recommend that you visit www.auvi-q.com. AuviQ is actually an epinephrine auto-injector. It's the first and only FDA-approved epinephrine auto-injector specifically for infants and toddlers weighing 16.5 pounds to 33 pounds, and it helps mitigate the risk of striking bone because it has the shortest needle length and the lowest available dose. I always recommend talk to your doctor if AuviQ is right for your child.
Great. Well, I appreciate you giving us some of your time this morning, Doctor. It's been a pleasure speaking with you. Thank you.
It's been a pleasure. Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Vivian Hernandez-Trujillo. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.